Everybody to another A Spotlight series. I'm your host Asan from Agate Intellect. All right, beautiful. Today's very exciting. Welcome everybody to another two great Spotlight series with me. I'm your host Asan from Agate Intellect.
Are going to present to you
today's very exciting.
really exciting work
Another
that we recently published in Nature, and namely deep learning enables rapid identification of potent DDR kinase inhibitors. All right, so I have with me Alex Zhebrak and Daniil Polikovsky. Sorry for if there is any butchering of the last names. But without further ado, let's jump into the talk. Alex, please take it away.
Thanks so much, and thank you very much for inviting us to present today. Being a fellow Canadian, it's a great honor to be presenting to your audience, and specifically University of Toronto, the home of multiple AI companies, including AI for drug discovery companies. And you probably know Brendan Frey, who is one of the people I admire and who runs Deep Genomics. So it's very nice to be kind of back. I used to work for ATI Technologies for several years. We were competing with NVIDIA at the time. Now we're collaborating with them, and have very warm feelings towards Toronto. So we're speaking about our recent paper on DDR1 kinase inhibitors and the implications of generative tensorial reinforcement learning systems to generation of de novo molecules. One great commentary that recently came out is last Friday. It was in Trends in Pharmacological Sciences. It's a high-profile journal, Cell journal. I think the impact factor about 12. How drug design augmented by artificial intelligence become a reality, by Hongming Chang and Dr. Ola Enquist. So those two names I'm following for a very long time. It's very difficult nowadays to distinguish who is who in pharma doing good generative chemistry. These two gentlemen are amazing, and we're following their publications with great interest. So they have deep knowledge about the subject, and we get a very balanced spotlight commentary. So I highly recommend going to this paper to read about how top people in big pharma think about this paper, because nowadays there is a lot of confusion about what is real and what is not, and it's important to understand both sides of the story, not only the computational chemistry component, but also AI. So I hope you can see my screen. We're presenting, we're conflicted. So we all work for In Silico Medicine, the company I founded. And a little bit about us. We are focusing on novel drug discovery, novel target discovery, target identification. So we are not originally the chemistry specialist. We developed this particular capability to be able to very rapidly validate targets. I'm going to be talking about that very briefly. We have our own internal drug discovery pipeline focusing on oncology, primarily in fibrosis. And we are trying to work on difficult targets. So whatever we are presenting today on DDR1, DDR1 is not a difficult target. It is there is a lot of information available about it, and we can use GENTRL as just one small piece of the pipeline to very rapidly generate small molecule inhibitors that are easy to synthesize. If you are going to go deeper into the molecules that were generated by GENTRL, there are lots of molecules that are more difficult to synthesize. And of course, they're very different from already known hits. So one important thing to understand for everybody coming from computer science background, and most of you are from computer science background, that's why we decided to include some of those drug discovery slides, is that drug discovery is extremely long and extremely risky. So you get much more failures than you get successes. And one great paper to read just to get yourself familiar with the process is this Nature Reviews drug discovery paper by Steve Paul from Big Pharma in 2010. You can see the time it takes in terms of the number of years to go from the presentation of the target to identification of the hit molecules, hit to lead optimization, and preclinical. And then this bullet is fired, passed to a different type of people who are doing clinical development, essentially designing clinical trials. You cannot do many changes afterwards. So here you do safety, efficacy. So you check whether the target you picked here is correct or not, 2.5 years. And then you do it in a larger study, 2.5 years, and submit. And basically, you are talking about more than 10 years in drug discovery, drug development. And it's extremely important to understand that here, before you do target to hit, you need to identify a target. And that might take days. So I can come up with a hypothesis right now and go. Or it can take decades, where you really go deep into validation of the target, try to implicate it with a disease. And the targets are very different, and some are extremely difficult, some are undruggable. These are the approximate costs in millions. So we're talking about very substantial amount of money spent before the bullet is fired. What we are addressing with this paper is essentially this. So target to hit, but the hits that we are producing are lead-like. So they're much more likely to pass in the through lead-up stage without too many modifications. So we are trying to accelerate this process with this paper. It's also extremely important to learn from mixed martial arts when you're doing drug discovery using deep learning. And you know that in the 80s and 90s, people were quarreling about who is better, the grappler or the boxer or the kickboxer or wushu versus karate. So they developed MMA, and UFC is now one of the really top kind of shows where you can see people outperforming boxers, outperforming grapplers. So you need to be very good at every step of drug discovery if you're getting into this. So first, you need to know your disease very well, you need to have a lot of information about the disease, apply multiple techniques to identify targets and to validate targets, generate the hypothesis, and then implicate the target in a disease, create disease target molecule association. And here you would generate the molecules that essentially choke the target, bind to the target, and disable the target. You have multiple other approaches where you can upregulate the target or modulate the target, or you need to do something with it so it's not as active, or it is actually more active than you want it to be. And the main idea is, regardless of what you do here, is you need to pass phase 2 clinical trials in your disease of interest. So that's the major objective, and you need to optimize everything you do to achieving phase 2 efficacy. And that's 8 years down the road. You need to be prepared for a marathon. So at Insilico, what we did, we developed a comprehensive drug discovery pipeline, which starts with target ID. So we build deep learned age predictors and then retrain on diseases, look at what features are different. Also, we're doing a lot of pathway scoring and publishing in nice peer-reviewed journals. So what we did in this paper is generative pipeline, and it's right here. So also multiple papers published. By implicating the target and disease and looking at how heterogeneous it is within a disease, you can also predict the outcomes of phase 2 clinical studies. We are doing that a lot, and it's kind of an additional separate school at Insilico that is focusing on this particular aspect. Some of the banks are using it. If you're interested in joining a company and joining this particular effort, we're quite interested in hiring people in this area. So one other interesting idea we came up with is, you probably are familiar with Altmetrics. It's the digital science company which produces that metric. We are really amazed by that, and it measures attention. So we're developing tools that are similar in tracking attention to a specific target. And very quickly, by looking at the target in the context of a disease, we can assess how novel it is. We can assess how well patented it is, how many clinical trials in the context of the disease happen, and you can see how accessible it is to our algorithms. So if you see something like this, so antibodies, protein structure is known, small molecules, it means that it's very accessible to this GENTRL algorithm that we're going to be talking about. Also, another extremely important paper that just recently came up in Science with System Translation Medicine. So scientists demonstrated that many of the targets that pharma companies are going after are actually not there. It's you knock out the target, you use the small molecule that is supposed to work about on this target, but and you still kill cancer cells or induce some sort of response. So a lot of molecules have off-target effects, and a lot of targets are not there. So it's extremely important to validate the targets early with tool compounds. You don't need a perfect drug to be able to validate your compounds, your targets. It's very important to validate your targets using knockouts and real chemistry. So to improve the outcomes in clinical studies. And you are all familiar with generative models, of course. This was a very important demonstration for everybody. Yep.
Alex, sorry to interrupt. Do you mind pressing hide on your Google Meet under, like, at the bottom of the screen?
So you cannot see my screen, or
no?
What?
Well, if you just press hide, like you see the center bottom of the screen, you have when you're sharing, a button comes up. It says hide or stop sharing. But if you press hide.
Okay, perfect. I did that.
Thank you.
Thank you.
Thank you.
Because we don't do it very often on YouTube. So perfect. So there was a very important paper published at ICML 2016, so 5th of June, demonstrating how GANs work and how they generate pictures. So, this small bird has a pink breast and crown and black primaries and secondaries. You can get this kind of bird. So for many, that was a revelation, and it became very easy for me to explain this. So essentially how we can generate novel objects in kind of continuous representations like pictures using generative models, and that many of them are novel, they do not exist in nature, and they're almost as good as the real thing. And we decided to do this for molecules. So one of the ways to screen for inhibitors for your targets is to go through through large molecular libraries and do high throughput screening. So essentially looking for a needle in a haystack, and you have robots that seed cells and then apply a large number of molecules to those cells to see if there is an effect. And that's one of the ways to find actives. Of course, you don't get perfect, and you don't very often know if the small molecule is hitting your target or not. Or you can generate perfect needle by by having a lot of information about the target, or now generating the target crystal, and identifying pockets within this target where the molecules need to bind, and then generating molecules for those pockets, or you're using already very, very well-known hit molecules to make something similar. And we started our journey in generative chemistry in late 2015, beginning of 2016. So some of the first papers that we came up with were submitted in 2016 in peer-reviewed journals. And actually another paper in October 2016 that was posited on Archive by Alana Spuro-Gudzik's team. It's actually considered to be, and Alana Spuro-Gudzik, I must actually thank him for everything he did. And by the way, we should acknowledge him right away at the beginning of this talk. He is a professor at the University of Toronto and one of the chairs of CIFAR. So one of the very, very top people in generative chemistry and quantum chemistry. Everybody in the student audience should approach him and see if you can, get a placement in his lab. So he published a very nice, important paper on variation autoencoder using SMILES representation of where he showed that it's possible to do de novo molecular design. But I think ours was pretty much at the same time. So ours came out as a peer-reviewed paper in November. And we used binary fingerprint representation of molecular structure and the adversarial models, multiple combinations of models, multiple representations of molecular structure, It's extremely important to understand that before you validate, before you synthesize the molecule, test it, and it works, you cannot really claim that your generation conditions are fully met, and that your generative model works. So, but to synthesize the molecules, it costs you a lot of money, and also to validate. So you have to do you have to think a lot about how to trade off speed for quality or for complexity, and very often you generate very nice molecules. You generate thousands or hundreds, and all of them look promising, but you can generate only 5 because it takes you, $2,000 to $10,000 to synthesize a molecule, and from days to sometimes months, and sometimes you don't know how good it's going to be. So it takes a lot of courage to synthesize them, to test them, because unlike images where you can very quickly validate, or text or sound, here you actually, the validation cycle is at least 3 months. So we did our first experimental validation of JAK3 kinase inhibitor for the entangled conditional adversarial encoder using SMILES. That was August 2018. And by that time, we were already kind of completing that study with DDR1 that was recently published. Of course, we have now many other models and amazing generative pipeline that can generate for very difficult targets. But again, unless you synthesize and test, you won't be able to claim anything. So we published a large number of papers in both the applications of deep learning to target identification and also to generative chemistry. So you can just PubMed and Silico plus medicine and go through our work. So we try to publish proof of concept. We also have, we're part of the consortium. Yep.
Alex, if I may. So you talked about, yeah, and very much understandable that it's more costly and more time consuming to validate the results of the generation when we talk about drug discovery. Are there, just broadly for the audience, are there ways to predict also the possible properties of, and do any of your models address that? And then what ratio of that you see to be true? So let's say, yeah, please go ahead.
Of course. So one way is to generate with specific generation conditions, and of course objectives if you're using reinforcement learning, and then use predictive modeling to see if any of your molecules are likely to have those properties. So of course we do that as well. Typically, that's not the way to do it, because real validation is the only thing that pharma would accept, and that we would accept now because we understand now the complexities. Typically, it depends on the target. It depends on the model. When you're just starting and you are using something simple, approximately 80% you should expect to be valid. If you're quite good. If the target is complex and you're doing it for the first time, there are no template molecules that you can use. Sometimes you fail entirely. Sometimes you get 50%. So to actually answer your question a little bit better, we decided to kind of form and participate in a consortium called MOSES. So this slide kind of addresses this question. And MOSES, it's molecular set, so you can fork us on GitHub. It provides you with a very clean data set to standardize model training, so everybody can start with the same set of molecules. It's annotated, and there we have we've implemented many of the generative models like char-RNN, variational autoencoder, adversarial autoencoder, junction tree, and a few others. AstraZeneca was just recently gracious enough to submit a model as well and contribute to this consortium, and a few others are doing that as well, those who are a little bit more advanced. Here we provide the range of benchmarks to evaluate the performance of your models without synthesis. Of course, again, you cannot really claim anything before you synthesize, but it's this Moses training set and the benchmarking system allows you to do this in software. And I can tell you, so if somebody could have told me this 3 years ago, I would be very happy. So, and I would really appreciate this to know how far you can go with generative models. So I can tell you that for kinase targets with crystal structure and known templates, so things like DDR1 kinase that you're going to see, the confidence level for us to generate hits. So you generate, you score, you annotate, you do some predictive filtering if necessary, and then you synthesize, test. For us, the probability of generating hits is about 100%. So close to 100%. So for kinases, the problem is solved with a lot of known templates. Then you have many cases. I mean, the kinase space is huge, and actually kinases are good targets, are amazing targets. It's just nowadays, pharma companies have a lot of experience with kinases, and they also consider it to be a solved problem, even though we still think that polypharmacology, achieving certain kinome profile, it's still an unsolved and pretty much terra incognita today. But if you know a crystal now and you have no known template, so no hits, the confidence level for hit generation for us is 80%. So we are, even if we have just the crystal, preferably several crystals, I can generate hits with 80% confidence. So I can make quotes to companies with specific, risk profiles. Then for GPCR, and other target classes, we can also do well. For GPCRs to date, we have multiple cases where we don't have the templates, but we have a crystal, and we get hits, and those are lead-like hits, as you know. And we have some where we don't have any crystal structure. The homology to the next closest thing is about 40%, and we managed to get 10% hit rates. But we also didn't have a budget to synthesize a lot. So again, unlike the pharma companies that are very often criticizing us for not synthesizing the most interesting molecules, not testing them, it's typically because of the budget constraints, and you of course don't want to publish the most the most promising ones in public literature because you are pursuing them internally. So now back to the paper, and I'll pass the word to Daniel in a few kind of slides. What's important here is that it took us a year to publish. So we submitted November 1st. And the AI crowd, so the AI reviewers were very happy. They immediately, accepted without revisions or made minor revisions, but people in drug development specifically criticized the paper significantly, and we had to go all the way into mice just to prove the point and repeat the experiment several times. So in this particular exercise, we were challenged by one of our partners, chemistry partners. They are kind of Ferrari of synthetic chemistry. They're best in the world. Everybody's synthesizing there. And they basically came up with a target space. We together came up with a target space where we could do this challenge. So could come up with a set of conditions that won't break our bank and theirs, and can prove that generative chemistry can be useful and can be done in a very short period of time. So we agreed to the kinases with a lot of known information. Then looked at what's marketable a little bit and where we should go. So the target space was narrowed, and then DDR1 kinase was picked by a set of arbiters, and we decided to go after that. So it took us 7 days to assemble the training sets and pick the model, 12 days to train, do structure generation, do the reward function, so coordinate maps, 2 days to filter, and then we started synthesis. So we identified 6 molecules out of 40 that were reasonably easy to synthesize, and we could quickly prove the point. Our partner synthesized it. We did some experiments like enzymatic assays, metabolic assays at their premises, but we also sent those to contract research organizations to have independent validation, and had to go all the way into cells, and then into microsomal stability assays, and then all the way into mice. So this is how it looked like. So it took us 21 days to apply the GENTRL system. Again, this is probably one of the 800 models that we have in-house, one of more than 30 that were validated and already plugged into the overall pipeline. It took us 46 days to validate up to microsomal stability assays. And then one of the reviewers asked us to redo the experiments and also go for mouse. We could take any one of those into mice. Again, due to budget constraints, we do just one. Confirmed good pharmacokinetic properties. And then we've actually implicated this target into a very interesting cancer that it wasn't previously implicated in. And we started doing PDX models. PDX is essentially human tumor traveling in immune deficient mice. A mouse, or in some cases, you have a mouse with the immune system matched to the patient's tumor. So we tested that, and it proved efficacy. On par with a very toxic compound, and this one is not very toxic. So this is a pretty cool exercise. And now I'll pass the word to Daniel, who is our head of deep learning in Europe. Daniel, please go ahead.
Hi.
Amazing. Just want to jump in quickly and say, I think maybe it's not necessarily a bad thing that we're using generative models since 3 years ago. There has been a drastic improvement over the performance of these models during the past years. All right, but without further ado, Daniel, please.
Absolutely. I also must say that generative models by themselves are more kind of theoretical when it comes to drug discovery. So you cannot do everything using generative models. You need to have a very comprehensive kind of MMA type fighting pipeline where those generative models plug and play. Sometimes you actually, in many cases, you don't need generative models. So genetic algorithms outperform. Maybe Daniel can talk about that. And also, you need to think about different representations of the molecular structure. So one common one is smiles. There are also graphs. We use something different in-house, but also, of course, smile and graphs whenever you have very high confidence that the model is going to work. So it's all about integration, and it's never about just one single model.
Makes total sense. Amazing. Right, Daniel, please take it away.
Yeah, sure. I'll go through a technical part of this paper. So my name is Daniel. I'm a head of deep learning research, the European division in Silica. So I'm here, right? All right. So I'll start with a brief introduction to generative autoencoders, because this is a central part here. And then I'll go through the pipeline that we developed to generate those potent molecules against DDR1 kinase. So I think you're all familiar with autoencoders. So those are deep neural networks that have two parts, the encoder part and the decoder. So you take a molecule here. It is represented in some format. I'll talk about it shortly. You pass it through the encoder and get some hidden representation. And then you reconstruct back to the original model, to the original molecule. So in general, if you train such model, you'll get these latent codes clustered around certain points. And if you try to traverse from like one point to another, then you won't reconstruct any valid molecule all the way, because here you have like 0 probability and you don't know how your model will behave here. So on the other part, you have a so-called aberrational autoencoder that trains a model in a way that your latent codes are distributed like a Gaussian distribution. And here you can take one point, you can take another, you can traverse and reconstruct valid molecules along the way and do some inference from their properties. So you can ensure such distribution by multiple approaches. The one is variational autoencoder, where you have a regularizer on the latent codes, which is basically KL divergence. You can also train a so-called adversarial autoencoder. In adversarial autoencoders, you train a discriminator to distinguish samples from a prior distribution and samples from the latent code. And you train it similarly to generative adversarial networks. So comparing those two, I personally prefer VAEs. So here you have a KL divergence between the latent codes for given data point and the prior distribution. For AEs, you minimize the Jensen-Shannon divergence between the actual distribution of the latent codes and the prior distribution. So for VE, there is one drawback. The minimum of this regularizer is Q of Z given X equals to P of Z. So you ignore the data, and that's not what you want in generative autoencoders, because we'll use those to learn the mapping from chemical space to some continuous space and do some inference there. However, you can battle this by minimizing by penalizing the KL divergence with a smaller coefficient, which is called the beta VAE, and it is pretty easy to train. So AEs, on the other hand, they minimize the exact thing that you want. So if the Jensen-Shannon divergence is 0, then the Q of Z equals to P of Z. So you match the prior exactly. However, it is much harder to train since you can't compute the Jensen-Shannon divergence directly. You have to apply adversarial learning. So you have a minimax game. It is much harder than training a VAE. Okay, so why autoencoders? Why not GANs or normalizing flows? So for autoencoders, we have two main things. One thing is they don't have mode collapse compared to generative adversarial networks. So mode collapse in our case would be like losing some type of chemistry. If this type of chemistry contains active molecules against DDR1, well, we wouldn't find those molecules, and it's very bad here. Also, they're pretty easy to train on discrete data. So because you have like discrete data, the molecules at the input and at the output, it is much easier to train because you don't have to pass the gradient through discrete sampling. Okay, so as a side note, generating molecules is much harder task than generating images, because images are they lie in a continuous domain. So you can change an image a little bit and still get a valid, for example, face here. For molecules, however, if you just change one atom, for example, here you replace oxygen with carbon, you'll get something toxic. So there is no trivial locality here. You can't just change the molecule a little bit and get a molecule with similar properties. So you have to be very careful here. And because of this, we try to learn this mapping from chemical structures to latent space, where latent codes of similar molecules in properties, not in structure, but in properties, will lie close together. So we trained a model on smiles. So a brief intro to smiles. It is a way to represent a molecule as a string. So you can see here two examples of a molecule and its smile string. So SMILE stands for a simplified molecular input line entry system. It works as follows. So you start with a molecule. You find, you build a so-called spanning tree. So you remove edges so that you get a tree, the graph without rings. And then you traverse this graph in a so-called depth first search order. And you get something like this. So let's see this on an example. So this is a molecule. We build a spanning tree and number the edges that we had to cut. So this is the first edge and this is the second one. We start from some point. There is a deterministic way to choose a starting point and the traversal order, but we don't care here about it. So start here, we write C for carbon, 1 for the link that we removed. And then we start traversing. So carbon, carbon, carbon. Okay, so here we have branch. we start going here, and we'll have to come back to this point later to traverse this path. So we open the bracket and continue traversing. So carbon, nitrogen, and also we have a link here. Okay, we come back here, carbon, close the edge, carbon, oxygen, close the final edge, and this is your molecule. All right, so you can validate that this mass is correct using a library called RDKit. So, and yes, indeed, you get the molecule that you wanted to get. Okay, so with generative models, we can generate molecules, but in general, we want them to have some properties. So just generating random molecules isn't useful. We need to somehow embed some properties, some quality metrics into the molecules that we generate. So the metaphor here is that if you randomly generate a lot of molecules and then try to filter all those generated compounds to find something useful, it will be like looking for a needle in the haystack. So it is, well, it's not that easy. For the model that we proposed, it is something like generating perfect needles directly, and you don't need to apply some filtering to extract only the perfect needles. So it is much easier to prioritize the final set of compounds, as we'll see on somewhere at the beginning, at the ending of the presentation. So there are two approaches, I think, that are most prominent here. For such tasks, for generating perfect needles, I think those are conditional generation. So you try to embed some properties into molecules, and you want to reconstruct the whole distribution of molecules that satisfy given properties. So it is this is a pretty hard task, but still you get a lot of molecules for given properties. On the other hand, you have an optimization perspective where you have some quality measure, and you want to find only a few molecules that have the highest value of this quality measure. So comparing those two, here you'll have some kind of diversity, but those molecules won't be very great. But for optimization, you'll get only a few molecules, but they will be much greater. So in our approach, we combine those two kinds of optimization. So we first trained a conditional model and then extended it to optimize towards potent DDR1 inhibitors. So let's start with the first part. Before this, let me show you some numerical examples. So we compared our model with a few other generative models for drug discovery, namely Organ, Rank, and ATNC. And our model is here, the GENTRL, generative tensorial reinforcement learning, and it performs much better in terms of optimizing two functions, the penalized log-P. Log-P is lipophilicity, and PQED is quantitative estimation of drug likeness, penalized, right? So we had to focus on one thing. If you just try to optimize log-P, you'll generate long chains because those have very high log-P, and those molecules are pretty useless. They're useful for generating soap. So we modified a function a little bit to penalize it with a so-called medicinal chemistry filters. So this thing estimates how drug-like molecules are and whether they have some toxic substructures or not. And so this restricted us to not to generate long branches. So we see here that we outperform with a large margin the baselines. And also, one thing you can see here is that this curve is pretty rapid. So this indicates that the number of molecules number of unique molecules is much smaller than for the baselines, which is actually a good indicator that the model converts to generating molecules with high reward. So it could have generated like smoother curve with more diverse molecules, but it would extend out to worse molecules. So it only generates molecules with high reward. Okay, so let's start with conditional generation. And here we proposed a so-called tensor train induced prior, or TTLP. Actually, we called it learnable prior here. So it works as follows. We try to tie in the latent space the structures and the properties. So we chose some properties. Those are medicinal chemistry filters, some property called medicinal chemistry evolution that shows how complex the model is, and also activity against DDR1. So the cool thing here is activity against DDR1 is known only for a few molecules, but MCF and MCE18 is known for all molecules. So we came up with an idea on how to train an autoencoder on a partial labeled data. So our goal will be to optimize an evidence lower bound on the marginal log likelihood here, again as follows. So you have molecules, and you have only observed properties. So you don't know some of the properties. For some molecules, you don't know the IC50. So we had to find a way to optimize it with partial labeled data sets. So as a motivation, we also show this image. So the prior that we proposed that can learn this joint distribution is multimodal. So there is also a motivation on why we want multimodal priors. So here you have an example on MNIST data set of latent codes in 2D. And you see here that since the Gaussian prior is unimodal, you have artifacts on the boundaries here, right?
Mm-hmm.
And with a multimodal prior, you won't have such artifacts. So because you can learn a separate component for different classes. Okay, so a bit of math here. So we needed to define a highly multimodal family of distributions, and we did it using a tensor train decomposition. So let's start with a discrete case, and then I'll continue to the continuous case. So in discrete case, imagine you have n random variables, R1 through Rn, and you can represent this joint distribution for these random variables as elements of a tensor P. Now, this tensor has a lot of parameters. If R1 takes values from 1 to R1, if R2 takes values from 1 to R2, and so on, then the number of elements here is the product of those R's, which is a lot. You can't possibly store this tensor even for like hundreds of variables, but we learn it for much more variables there. So how do you approximate it? We apply the so-called tensor train format. So it is defined by three-dimensional tensor skews. Those are called cores. To compute the value of the tensor at position R1 through Rn, you slice each tensor along first dimension. So for example, this tensor Q1, you slice it along the first axis, and you get a matrix of the size k by k. K here is a hyperparameter, which is similar to a rank in low-rank approximations of tensors, right? So you multiply these matrices, you get a matrix k by k, but here you want to get a scalar, so you multiply it by a vector of ones from the left and from the right, and as a result, you get a scalar. Okay, so this is a formal definition of tensor train format, and you can do a lot of cool things here. So we already see how we can compute the joint distribution, but what about marginalization? So we can marginalize out our I, so the ith random variable, out from the distribution by simply summing up the core Qi along the first axis. So you can do this in one line in PyTorch. It is very simple. So you can marginalize. You can also marginalize other variables. For example, if you want to compute a normalizing constant, that is, you want to marginalize out all the variables, you just sum up each tensor along the first dimension, multiply, and get a scalar. Okay, so now you know the joint, you know the marginal. If you divide marginal by the joint, you will get a conditional distribution. If you know the conditional distributions, for example, one-dimensional conditional distributions, you can sample from this tensor using a chain rule, and that defines your probability. Right?
Sorry to interrupt. Dividing joint by the marginal, you meant?
No, marginal by the joint.
Okay.
Yeah, that's the definition of the conditional distribution, right? Ah, yes. Sorry, joint by them. Yeah. Okay. Yeah. Yeah. Sure.
Yeah. So okay. Yeah. So let's take it from that's very interesting. Okay. Yeah. So you divide the joint by the marginal distribution to get the to get the probability.
To get a conditional. Yeah, you can get one-dimensional conditional distributions. You can sample using a chain rule, and then you get the samples. You can also train those cues using gradient descent if you plug it into some neural network. So it's pretty simple to train. So, but this works only for discrete case. How would you train this model for continuous case?
Well, I just want to point something out very, very quickly. Fascinating so far. If I'm jumping to conclusion, then we just get to it when you get to it. But with this trick, will we suffer any performance issues? I would just want to draw a conclusion, maybe a comparison between similar things that happen all over natural language processing, which is a good chunk of my background. If you go from vocabulary space to character space, you do minimize your vocabulary size. We have a similar exponential problem. But it comes at a cost, because now you have 26 variables, amazing, which you can reconstruct the original. But some parts of the regime you won't be able to explore. So there are ways now to sort of compromise between the two. I was just wondering if you've seen any performance being affected by it. And also very quickly point out that we have 10 minutes. Is it possible to wrap up in the next 5 minutes, and so that I have 5 more minutes to answer the questions?
Sure.
Is it possible? If it's not, or you prefer to go, to go with a different pace, then maybe we can stay, 5 to 10 minutes over. But up to you.
Okay, I'll try to be brief here. Okay, so regarding your question, if k equals to 1, on the next slide, when we show how you manage to add how you add continuous variables, for k equal to 1, you'll get a standard Gaussian, so it is like a factorized distribution. So the Gaussian distribution is a special case of our distribution, so it can only be like more complex than the standard VAE with a Gaussian prior, so we don't suffer from it here. And also for tensor train format, there is a cool theorem that says that if k is large enough, you can approximate any tensor up to some accuracy. Okay, so we don't have a problem here with k. So actually, we got a paper accepted to NeurIPS 2019. It is called a prior of a Google Gaussian, so tensor ring induced prior. So it is a slightly advanced thing. We use tensor ring here. It has slightly more advanced properties. And then there you will find the comparison for different case, how the model performs in the factorized case, how it performs for large ranks, and yeah. So it will be published soon, so at the NeurIPS conference in Canada. So if by some chance you plan to visit NeurIPS, come to our poster.
Absolutely.
All right. So how do we extend this to the continuous case? So the standard way, well, the simplest way here would be to take a Gaussian mixture model. So in Gaussian mixture model, we have discrete latent codes. So those would be component indices. And then you have a factorized Gaussian, okay? And we can represent these component weights in a tensor train format, and it will contribute only to around 10% of the VAE. So it is pretty light, and you can train it end-to-end in VAE by optimizing this lower bound. So compared to the standard VAE, in conditional case, you'll only have this difference. So you'll have to optimize the probability of observed properties given the latent codes. So it is pretty simple to implement. We'll outsource the code for this paper complete, and we also have already published the code for the DDR1 inhibitors. So you can check this out. It is pretty simple to implement. Okay, so this is how it looks like in 2D. So in our NeurIPS paper, we show how it works for multiple generative models for VAEs and GANs. So you can see that the model learned a highly multimodal latent codes. So probably those correspond to some different clusters of the data. Okay, now I'll go briefly through the optimization part. And there is one very interesting idea that I personally like very much. Well, yeah, in RL, you have like some reward function. For our case, it was a sum of 3 simple reward functions. This one, the general kinase SOM, SOM stands for self-organizing map. So this one is a predictor if a molecule is an inhibitor of some kinase.
Okay. Daniel, you were cut out for like the last 5 seconds. If you want to, I heard. So
okay.
you talked about some self-organizing maps. Yes, please carry on from there. Thank you.
Yes. Okay. So I was saying that our general, it is a general kinase SOM. It is a predictor if a molecule is an inhibitor of some kinase, not exactly DDR1, but any kinase. Then we have a term that corresponds to specific kinase SOM, which is a predictor if the molecule is an inhibitor of DDR1 or not. And finally, we have a trending SOM. It is a thing that will output 1 if the predictor thinks that this molecule is novel, and 0 if it is like well-known chemistry, right? So you can optimize this reward with reinforced, pretty standard technique here. One thing that we found useful is that we fixed a decoder during optimization. That is, the mapping from the structures from the chemical space to the latent space is fixed, but instead we optimize the latent space. So we have this prior p psi, the one that is represented in a tensor train format, and it extends towards molecules with high reward. So we found that it is much simpler, it overfits less, and it converges pretty fast. Okay, so that's how you can build RL part into our model.
Really nice.
Yeah. Okay. So self-organizing maps. I'll just show you some cool pictures of self-organizing maps. So this one is trained on the year when the compound was discovered, and you see that molecules that were recently discovered clustered here. So we get reward 1 if we generate a molecule that lies in this part of the space. Also, this is the self-organizing map for kinases. So these are kinases, and DDR1 kinases, I believe they lie somewhere in this small region. Yeah, so we have those 3 rewards. Okay, so final part, we have trained a model. Yeah, we did a pre-training of a latent space, and then we optimized the reward. We sampled 30,000 compounds. Then we ran through a filtering procedure defined as follows. So those are pretty standard rules. So you apply medicinal chemistry filters, you cluster so that you have diverse molecules. You remove molecules that are too similar to the training set. You also apply the reward. Well, because you can't calculate reward, you can only take only the molecules with high reward. Then you pass them through the pharmacophore hypothesis, and finally you do some multidimensional scaling to see how these lie in 2D. So here you can see that molecules that passed 5-centered pharmacophore lie here, molecules that passed the 4-centered pharmacophore lie here, and then we sampled uniformly and got 40 molecules. So those are the output. This is like the step where my part in this research ended. So we gave these 40 molecules to chemists. Then they sent it to synthesis. So 2 of the molecules have nanomolar activity less than 100. So this is a very potent molecule with 10 nanomolar activity. I guess you can say the molecule is a primary hit if it is less than 10,000. So 10 is much less than 10,000, right? So this is pretty close to, yeah. So this is pretty close to even single-digit nanomolar. It is a very potent molecule, and I guess this is the one that was tested out in mice. Okay, so I have a business card of Alex here. So yeah, that concludes my part.
All right, amazing. Wow, I'm blown away. Thank you very much for the really good presentation. Let me ask, so for the official time, we got 3 minutes. And then we may go a couple of minutes over if you guys don't mind.
Yeah, on our side, we can go over, yeah.
Okay, beautiful. Thank you very much. A few questions were asked. Some of them were answered. So I'm just going to filter the ones that I believe haven't been answered. Okay. Okay, most of them actually have been answered. All right,
Okay.
amazing. Let me see. Okay, yes. So this is this one is a little bit more on the a basic side, since most of our audience are from comp sci. It was asked, what's the difference between the crystal structure and template?
Oh, okay. So crystal structure is something that describes the target. So you typically have a protein sequence, so an amino acid sequence that is organized in a certain way to form a protein. And depending on how this protein is kind of folded, what subunits does it have, what structure does it have, it defines its properties. And to understand that, you cannot really, I mean, you can, but you cannot really precisely model that in silico. So typically you crystallize you extract and crystallize the protein, and then you analyze its surface and get a crystal structure representation. Can do it for the protein itself, but typically you do it with some kind of molecule that binds to it, and you co-crystallize. So basically, the crystal structure describes the protein of interest or the target of interest. And the template, it's a small molecule that binds to that protein. So you already have done this kind of either high throughput screen, or you synthesized, tested, and something binds to this target. Either you see it through binding assays or enzymatic assays. And you use that molecule as a template, as an example, to produce molecules similar, or at least with similar properties.
Amazing. So there are, I think, two more very interesting questions. So one, Uzbey, one of our members that's also active in the area, has asked, is there any reason a high number of the filtered molecules are still synthetically hard to access?
It's actually a very good question. So many of the molecules, if you're talking in the context of this paper, most of them are synthesizable. It's just some of them are a little bit more difficult to synthesize than the others. Very often when you generate using more advanced techniques, there are molecules with several chiral centers with structure that is not easy to synthesize and even to predict the synthetic route, because those are very large novel molecules. And very often it takes a long time to even plan this kind of synthetic route. There are, so including at in silico, but other companies and many academics groups are working on synthetic route prediction, and also basically synthetic accessibility prediction. So I would say we're talking about maybe a year's worth of time before that process becomes automated. As a matter of fact, again, Alana Spurugudzik at the University of Toronto, the probably top 5, maybe top 1 luminaries in this field, he is working on that as well.
Amazing. We have more a little bit towards a technical question, and then a couple of enthusiastic questions from the audience. So one, I would say, you've used autoencoders, and they're not known necessarily for being sequentially or structurally aware. People have used RNNs, for example, to better understand the structure and the sequence and the sequential information, which I would assume is abundant in this space. What are your thoughts on it? And are there ways that your maybe the RL part kind of accounts for some of it? What are your thoughts on it? Is it, or would there be? Is it included in your future work? Or?
So it's current work. It's actually already kind of past past work. It depends on case by case. So sometimes adversarial autoencoders are good enough for your application. Sometimes you need to go, into a completely different route. And Daniel, without disclosing the current the confidential information, maybe you can talk a little bit about the model zoo.
Yeah, so I think for the published parts you have like okay, so usually you have fingerprints or smiles or graphs or 3D structure, right? So those are commonly known 4 directions for research in generative chemistry. So apparently there is a lot of research in language, in natural language processing. So there are a lot of algorithms for generating strings. So it seems like this area of research is pretty complete in generating strings. So there are a lot of algorithms to generate molecules in smiles format, but there aren't many for graphs, for example. So there is a lot of research going on. There are a lot of papers published on how you can generate graphs, but currently it seems like many graph-based approaches perform much worse than smiles-based. So you also have fingerprints. So this is my favorite part actually. So some people think that generating fingerprints is useless because they don't uniquely represent structure. But what we did in one of our papers, the entangled conditional adversarial autoencoder, we conditioned the model to generate molecules with a given fingerprint, right? So you have a fingerprint, and then you generate all the chemical space that have the same fingerprint, and you have a lot of data to train it. But for small data sets, when you want to do conditional generation, you can train a small, fully connected generative model to generate fingerprints based on conditions, and you don't need a lot of data to train this. So you can train this small generative model and put it as an input to the we call it a decoder from fingerprint to the molecule, and it is very simple to train. So you don't need to have a lot of data. So finally, you have 3D. So there's a lot of 3D going on. You have point clouds, you have 3D convolutional neural networks, but there are a few challenges. For example, you don't know the conformation for many molecules. For example, if you just download a few million molecules in zinc, you won't have 3Ds. You have to somehow find out how these molecules lie in the pocket. You should run some extensive simulations. It is very costly, so you have to figure out the way to do it optimally. Okay, and there are also some new representations, mostly like string-based. There is a lot of research going on there, multiple novel languages, but they currently seem to perform on a bit worse than smiles on like the general task. So some of them are useful for genetic algorithms, some are useful for optimization, some are useful for conditional models, and so on. So yeah, this is the state of the field, I guess, in representations of molecules.
Amazing. Very, very, very exciting. All right. We have a couple of still very good questions, but unfortunately we're out of time. So I'll try to ask them from our guests, and if they have the chance, then they'll reply. Thank you very much for joining us for this session, and thank you the presenters. Very exciting work indeed. I'll see everyone next time.
Excellent, and thank you very much for inviting us. As I've mentioned, our mission is much bigger than just generative chemistry, and the company in silico is looking at extending of healthy productive longevity, because everything outside productive life extension is pretty much a waste of time. So if you can reprioritize your research interests in that direction, we would be very helpful.
Okay, now that you mentioned it, actually, there was a question in the audience. They're very interested into getting into the space. You did, I believe, computer scientists and computer science practitioners asked about, aside from your own research, where is a good place to start?
Well, I can tell you the last place to start. It would not be very politically correct, but okay, I'm not going to say that. I think a good place to start would be to find a lab like Alana Spurogudzik and gradually transition into this field. Then as you go along and you understand all of the complexities of big pharma and pharma in general, because again, guys or girls, when I was getting into this from computer science background, I was much more optimistic, and some things that some things that go on in the pharma world are not that easy to predict or generate using AI or any kind of technique. So sometimes, the molecules get stuck on customs and they become insoluble because of, whatever reasons, or there are so many things that can go wrong on the chemistry side, on the biology side, too many variables to account for. So my recommendation is to get start in Alan's lab or somebody else's lab in that area. In Canada, there is a great company called Deep Genomics. They are real. We respect them. There are many others that out there that we do not respect because they don't publish and just make all kinds of incredible claims. And then you can transition to big pharma at some point in time. It's nice salary, but typically that's not where the innovation happens. And you can try and change it from inside. Or join, Microsoft. Looks like they are quite active in this field as well, but also could use some help. Or join us.
Absolutely, amazing, gentlemen. Any final remarks you would like to make?
Well, again, it's a good idea to look at papers not only at NeurIPS and ICML. It's important to go into peer-reviewed journals, specifically American Chemical Society journals, Nature journals, where you can get some experimental validation and at least some medicinal or computational chemists reviewed the papers. Because very often what we see is that if you take a conference paper or something on arXiv, it might have nice seeds for some ideas, but it just doesn't work. So it's important to, or you have overfitting, or it's just not enough training sets, or you're completely following completely wrong approach. So it's good to go with the journals that have rigorous peer review.
Yeah, I'd like to say a bit more on this. So it's a very fine thing that if you take a deep learning paper, then you'll see some structures and they optimize some metrics. But those metrics that are optimized in deep learning papers, those don't match the actual rewards that you want to have from the molecules. So if the central part of the paper is a deep learning algorithm, or maybe some other algorithms, then people tend to focus on some simple objectives that are far from what should be optimized in practice. And if you show the molecules in these papers to chemists, they like, what? Like these molecules are very far from something stable. Those are very toxic. You shouldn't show them to medicinal chemists. Yes, and the opposite thing happens in in journals where the central part is chemistry. So people there are more interested in compounds, the techniques, how you validate the how you synthesize, how you test the molecules in mice and in vitro. Yeah, and the algorithm tends to be washed away. So the main part there is how you synthesize. So I think we did a good job here with the TensorTree, Tensor introduced prior and Tensor trained learnable prior, that we submitted a paper to Nature Biotechnology where we show the chemical part, and then we extended this algorithm and submitted it to NeurIPS and got the paper accepted, where we show the mathematical background of this approach. So I think we succeeded in both parts, where we show the the chemistry part and the deep learning parts, and how they work together to generate novel potent inhibitors.
Amazing. I think it's a really important. Thanks for making that point. It's a really important point. I think that most of the complexity comes from the space that computer scientists may not be inherently exposed to, prior. Again, thank you very much, gentlemen, for your contribution to this space. Being a Canadian, obviously, we're very proud of that. And also thank you for joining us and helping public and the scientific community's awareness in the area and in your cutting edge contributions. All right, thank you everyone for joining us. Thank you the audience as well. I'll catch you next time.
Thank you everybody. Bye-bye.
Thanks, bye.